Hello, my name is Dr. Michael Morrissette, and today we're going to talk about carbon dioxide laser skin resurfacing. The carbon dioxide laser is the high end of the spectrum whereby heat is used to stimulate collagen deeper in the skin. It is a wonderful treatment for the skin, and I highly recommend it for any patient that is capable of undergoing this treatment. When we're talking about a CO2 laser, we are talking about a form of heat that is going to penetrate the underlying surface of the skin. So in a situation where a patient would be awake, this would be a painful treatment. However, in our practice, we use intravenous sedation for all of our CO2 resurfacing, so patients do not experience any pain whatsoever. The treatment is usually carried out on the face and often on the neck, and it takes approximately 45 to 50 minutes to complete the treatment. During this time, you are completely asleep, you do not feel anything, and once the treatment is over, there is no discomfort whatsoever. One of the aspects of CO2 laser resurfacing is that there is going to be a recovery, and there are certainly going to be results. Oftentimes, patients will undergo a treatment that has either minimal or little to no downtime, and sometimes that equates to minimal or no results. With the CO2 laser resurfacing, you are going to experience a recovery of about a week's time, and approximately 2 weeks after surgery, your skin will start to look really smooth, really healthy, and really tight. And this will go on for approximately up to about 3 months of treatment time to see the final results. But there will be a significant change and improvement in your skin. I typically want patients to be able to go back to work within 1 week. So I will change the settings on the CO2 surface depending on your skin type to allow for about a 5 to 7 day recovery, where in many cases patients are able to apply makeup at day 7. Not many people have the amount of recovery time that can go on 2 to 3 weeks. So our goal is to have you back to work in a week looking somewhat decent so that you can go back, either apply makeup and be back at your job in 5 to 7 days. Okay, with the CO2 laser resurfacing, for most people, it's a one treatment and done. And that's what I love about the CO2 resurfacing, is that you have one treatment and you are completely done. Now, in some cases where there are deep perioral lines, especially what are traditionally called smoker's line around the lip, if those lines are very deep, I will inform patients that in that particular area, we may need to retreat that area 6 months later, 3 months later, if their goal is to completely eliminate deep perioral lines. So most often patients, if they do need a retreatment, will only retreat the area of concern. But by and large, my goal for CO2 resurfacing is going to be one treatment and done. Now, having said that, let's talk about who's really a candidate for CO2 laser resurfacing. So since it's a form of heat, we have to be concerned about our different skin types and how they respond to heat. So typically, patients who have European background genetics, such as people from Great Britain, Ireland, Scotland, Germany, Norway, Sweden, those types of skin types are considered classification 1 and 2, and those are ideal candidates to undergo laser skin resurfacing. The difficulty with CO2 laser resurfacing is that the darker the skin type, the more risks are involved in terms of having difficulty or problems with hyperpigmentation or hypopigmentation. So traditionally, patients who are not candidates for CO2 laser resurfacing include African Americans, Asian Americans, and any really dark skin type, dark Mediterranean types, dark Italians. And that spectrum of in between, if you're, let's say, partial Latino, you could still be a candidate for laser resurfacing. In those particular cases, we'll prep your skin 4 to 6 weeks before the laser resurfacing with medications that will help prevent hypo or hyperpigmentation. So we can treat patients along the spectrum to about a skin type 3 or skin type 4. And when we talk about skin types, we talk about skin type 1 to skin type 6. And the darkest skin types, as I mentioned, are skin types typically 5 and 6.